Hello and welcome to this special edition of the Manatee Glens Report. I'm Sandra Guffey, the Public Relations Director for Manatee Glens, the specialty hospital and outpatient practice for mental health and addictions in our area. Today we are honored to have Manatee Glens President and CEO Mary Ruiz. Mary has recently celebrated her 25th year at Manatee Glens, where she has held leadership positions in hospital administration, corporate and health systems planning, business development, and government relations. Mary has served as president and CEO for the past 16 years. She has been recognized regionally as well as nationally as a champion of behavioral health. Mary, thank you for joining us today.
Oh, I'm so glad to be here, Sandra.
Manatee Glens is certainly a complex operation.
Yes.
How do you explain it when people ask you when you're out and about and they say, what is Manatee Glens?
I think you did it well. It is a specialty hospital and outpatient practice for mental health and addictions, and we serve 1 out of every 30 families in our community. It's, I think, surprising to people. They feel alone with their problems, and we serve the whole community.
And you mentioned behavioral health, and I think before we get too much into Manatee Glens, we really need to talk about what's on the hearts and minds of everyone because of the news recently, the massacre up in Connecticut with those school children and the teachers. One thing is it's opened up a discussion on behavioral health. What is your input on that? What are you thinking about that?
There's a great deal of sadness for me, not only for the families and the lost lives, but for the whole country, because for so many decades, we have left these families struggling with serious mental illness without enough help, without enough resources, without enough treatment. And it's always been true that we are one community. We all pay the price when we don't take care of our own. And I think it's time for reflection to look, what do we need to do to truly make mental health and addictions treatment available to everyone who needs it. Right now, estimates are we're only serving half the need for mental health treatment and 18% of the need for addictions treatment. Terrible things are going to happen when our country is in that kind of situation. So I think when we move past our grief and we look towards our healing, we need to look at helping families who are struggling with mental health and addictions with a loved one.
And there is help. And that's a theme that I know you always bring up and we're going to touch on throughout our discussion today. When you look back over the last 25 years, there must have been some incredible milestones. What stands out to you?
I think the opening of Manatee Glens Hospital, that ribbon cutting with Commissioner Pat Glass, and one of our founding board members, Joanne Duke. We opened the first nonprofit hospital in the region, and that hospital has helped support not only care for detox and psychiatric care, but also made available services to people who otherwise couldn't afford it. So that was definitely a highlight in my mind.
25 years. That's a long time in today's standard.
People are calling me for historic perspective. I think that's how long it is.
History is relative here, but what keeps you here for 25 years?
Oh, well, that's an easy question to answer. I think the dedication and compassion and humanism of the people I get to work with. I mean, you're working with folks who have chosen either to go to med school or psychology school or social work school because they want to help others. And also the courage and humanity of the people we serve. It is not easy to face chronic lifetime illnesses that don't have a cure yet. And for me, every one of those people is a profile in courage. I learn so much about what it takes to be a good human being from our patients. So I'm very lucky. I'm very lucky.
Well, and I think that we don't want to dwell on the past. There are certainly many things that have happened and have put us here today. But maybe we can talk a little bit about where are we right now. Manatee Glens does serve at the hospital and addiction center. 4,000 people were admitted in the last year. Tell me about that. Where did they come from?
I think people, when facing an emotional or addictions crisis, really don't know where to turn. And when all else fails, they think of the emergency room, which is a good place if you have a medical emergency. But if it's really a behavioral health crisis, Manatee Glens Hospital and Addiction Center is open 24 hours a day, 7 days a week. The psychiatric doctors and nurses are waiting for you, and we don't charge for that emergency room visit. So I think people come to us because family members are concerned. Sometimes there's a realization that a person, needs help and they come in on their own. People basically come to us through family and friends, and so we really rely on families and friends to notice when something's maybe too serious to handle alone.
So 4,000 people have made that step, and that's a bold step for a lot of people to say, I've got a
500
problem.
of them are children. So I do need to say
Yes,
that as well. Manatee Glens Children's Crisis Center is the only inpatient unit in the county, and we do serve about 400 kids, 400 to 500 kids a year.
Excellent. The call center, which is interesting because that's available for all kinds of needs, 99,200 inquiries.
Makes me tired to hear you say that.
Answering all those calls. But you have full-time people doing that.
Well, our nation is looking at health care, and we're trying to promote access to care and patient-centered care. And Manatee Glens has really embraced that with the call center. With one call, you can talk to a counselor, get some information about your needs, and leave with suggestions on what's the next best thing to do for yourself or a loved one. So those 99,200 calls are people seeking help. For kids, for adults, for seniors, for mental health, for addictions, and they leave with an answer in about an average time of 6 minutes.
And it's a person, they get to talk to a person. They don't have to push buttons for a menu, which is really nice.
90% of our calls are answered live. The rest are answered the same day.
Excellent. That's a refreshing change. The walk-in center. Now, we all know about medical walk-in centers. Those have become pretty popular. The Manatee Glens walk-in center served about 7,100 patients last year. What is that?
It is a mental health and addictions walk-in center. If it's not serious enough for inpatient, but you can't really wait for an appointment, you just walk in. Counselors are available, again, face-to-face to assess the situation. One thing, I have a heart for families struggling with what to do, and my message is, you don't have to do it alone. You can come to us at the walk-in center, get advice, hear about whether it is more serious than you think or it's not as serious as you think. Here's the next step. And we don't charge for that first visit to the walk-in center either. So we saw 7,100 people who came in worried and left with answers.
But according to the statistics, then that means that there's probably 7,000 others out there who did not come in that need it.
Yes.
So we've got to wait. There's a little room for growth, it sounds like.
Yes, and it's downtown at 379 6th Avenue West, Monday through Friday, 9 to 6. Just walk in.
That's easy to reach. Manatee Glens Prevention touched more than 5,000 students. What is that?
We are concerned that kids are getting involved with alcohol and drugs at younger and younger ages. 9 is frequently the time when they sneak that first drink out of their parents' liquor cabinet. 11 may be where kids are starting to actively experiment, maybe with pot, and increasingly the first drug of experimentation are prescription pain pills. So we want to reach those kids in the schools and give them the message of how to deal with it, how to deal with that peer pressure, where to look for help, when to know that you might be in over your head. So we go to the schools. We're welcomed there by the school board, and we offer kids programming to give them insight into these issues so they're not struck blindsided by it.
Manatee Glens and the Safe Children Coalition, they work together, served more than 700 families. What is it that they do?
The Safe Children Coalition is led by the Sarasota Y, they're our lead agency, and then many, many nonprofits and also our sheriff work on keeping kids safe who may be abused and neglected. I'm very proud of that 700 number because it's actually lower than it was in 1999 when we started. So we've actually diverted families, even though we're a much larger community now, from the child abuse and neglect system into the social service and treatment system.
Excellent. That is good news. Well, we could get wrapped up in numbers and statistics, but really each of those is a person, a life, a story. Manatee Glens is truly involved in the fabric of this community. What stands out to you when you say, wow, we are really making an impact or difference in this particular area?
I think I'm most proud of our partnership with Manatee County government. I think our county commissioners deserve a lot of credit. They fund over $3 million a year in care. They partner with us through the sheriff to divert people from jail and into treatment for alcohol and drug problems. They work with us on a hospital without walls for children who would otherwise end up in juvenile justice or residential treatment. We can go into the home and give those families courage that they can raise those kids. So without that partnership with the county, and there are many more things we do with the county, I think this community would have far fewer options for families who need help.
Absolutely. Addiction's certainly something that it touches so many lives. And I know earlier in the year you gave us a tour through METV of the Hospital and Addiction Center. That place has recently had a facelift. It looks terrific. Tell me about some of the services. What actually happens in the Addiction Center? Somebody comes there, what's going to happen?
We start with the Access Center. We want to make sure that people are medically safe. We'll look at whether they need detox, and they have two options for detox. They can detox inpatient or outpatient. Manatee Glens was the first outpatient detox service in the state of Florida, and people can go home and still maintain their home responsibilities if they meet the medical criteria. After detox, then we're going to look at, well, what do people need next? Do they need residential treatment, the classic 28-day program, in order to start recovery? The Addiction Center accepts both men and women, offers scholarships for parents putting kids at risk because of their own substance use. Or perhaps people can do with intensive outpatient, coming 3 times a week in the evening after work, working with groups and our counselors and our physicians. And so they don't need residential treatment. If they need something in between intensive and residential, we have partial day where you can come on our addiction center just for the day and then go home at night. So one of the great benefits of Manatee Glens is we have different levels of care that can match an individual's needs.
It's really innovative. It strikes me how Manatee Glens has flexed to serve the people rather than saying, here's the program, hope you like it.
That sums up our philosophy of care. That's why we go in the home for kids. It's why we offer outpatient detox. It's why we have a walk-in center. It's why we go to the schools. We're trying to listen for what the community needs from us, and then we're going to reinvent ourselves.
And it's a constant process, isn't it?
It is.
You're never finished.
The staff know. Change is a constant at Manatee Glens.
We talked about, you touched on the sheriff and our great relationship with them. I think people would be surprised to know some interesting things about what was happening at the jail and how Manatee Glens came in and really helped this.
Sheriff Stubbe, even before he was sheriff, when he was a colonel, was very interested in working with mental health and addictions because he saw so much of what took up law enforcement's time wasn't law enforcement. It was people who needed help. So he initiated the crisis intervention training. Each year, we work with the sheriff and people in the community to train law enforcement officers in how to deal with mental health issues on the beat, in the street. You know, law enforcement officers have quite a few tools in their training to deal with public safety and arresting the bad guys. What do you do when the situation is somebody's just not in their right mind, that they're not oriented? If you touch them, if you give them commands, they can't respond. So we help law enforcement trained to keep themselves safe and the mentally ill person safe and know what the options are. And we have been doing that for over 12 years. The sheriff also noticed that he had a census of about 1,300 people in the jail, and it was built for 1,000. And many of the people in the jail were there because of mental illness or alcohol and drug issues. So he has worked with us for many years now in a Marchman project. The Marchman Act is involuntary commitment for somebody who has alcohol and drug problems, who maybe doesn't have insight that they need help. The sheriff has an option. They can bring that person to jail if they have committed a crime, or they can bring that person to Manatee Glens under the Marchman Act. We'll triage, we'll link to all these levels of care, we'll help people start recovery. Since we've implemented these various diversion programs, that's only one of them. We also work with the courts at first appearances. We go in the jail and offer prevention and intervention for alcohol and drug. Many, many other programs. The jail census has dropped by 25%, and the occasions when the sheriff has to detox somebody in jail is pretty rare. So we've had a great success diverting people from the criminal justice system into the treatment system. If we can treat them, the sheriff is not likely to see them again. 79% of the people who start treatment at Manatee Glens for alcohol and drugs successfully complete it.
That's stunning.
It's hopeful.
It is. It's hopeful. Well, and the taxpayers win too, because isn't it a lot more cost effective to treat them rather than incarcerate them?
Absolutely, especially since the recidivism rate, you know, again, you know, there are certain people that the jail staff know by first name because we're not diverting them from the criminal justice system.
No. So work with them where they are and help them.
I loved working with the courts and law enforcement because people are much more motivated when the choice is jail or treatment or you know, incarceration or drug court or DUI court.
You talked about working in the community. I think people are a little surprised to learn that Manatee Glens is a research hospital and teaching, research and teaching hospital. How does that work?
Well, we do clinical trials inpatient with Florida Clinical Research Center. It's really helpful for people if they're not benefiting from the medications that are available now in the market. Maybe the next thing coming up is what's going to help them, and they also get free medical care, which is helpful for people without insurance. So we do psychiatric drug research with Florida Clinical Research Center. And the training that we do is tremendous. We train over 200 professionals a year, starting with medical students at Lake Erie College of Osteopathic Medicine, moving to nurses with Manatee Technical Institute, and pre- and postdoctoral students. We call it our international pre- and postdoctoral program because we did have someone come from Amsterdam. So people come from all over the country and train with us, and also social workers and masters, family therapists. So we feel very proud of this because we feel that people trust our competency and have confidence that we know our field because they're allowing us to train the next generation of clinicians.
Absolutely. We know about the shortage, upcoming shortage of physicians, so this is going to be very important, certainly going forward. And I think people need to understand that the clinical research is the highest level, and the care that people get, they do such a good job. It's really
the protocols are peer-reviewed and of the highest standard. The safety is very high. And I think people also like the fact that they're contributing to medical science knowledge. They're helping everyone who can benefit from these medications.
Yes. So, and it's exciting that Manatee Glens is part of that. So really on the front lines, cutting edge there. You know, I think a lot of people are overwhelmed with the enormity when you kind of lay all of this out between addictions, mental health, behavioral, children, all of this. How do you personally keep from being overwhelmed by it all?
Well, you know, there's a serenity prayer that the 12-step programs talk about. You know, give me the serenity to accept what I can't change. Give me the courage to accept to change what I can, and the wisdom to know the difference. And so, if there's a situation that I cannot influence, then I'm at peace about it. if there's a situation where I can get the community together, where we can work on a problem, where we can come up with solutions, I'm on it. And you know, working hard on something, even if it's difficult and it's frustrating, is very satisfying for us all if it's something that we love. So I walk the 12th step on that one. That's how I do it.
That's excellent. I think the 12-step program is a very important one. We're very proud to have that at Manatee Glens.
We partner with AA and NA and have groups, and these are, of course, separate organizations from Manatee Glens, and they have their own standards. But the 12 steps are really a spiritual journey. I think people are surprised to hear that. Serenity is a spiritual concept, and so it's good for everybody, even people who aren't dealing with alcohol and drug problems.
Absolutely. We can all use a little more of that right now. Before we go into the future a little bit, let's talk about something that is also on the minds, and that's the new health care legislation and
Yes.
that act. What will that mean as far as behavioral health and mental health?
I think that there's a lot of confusion about what healthcare changes are coming. And so the good news is that mental health and addictions benefits are part of the essential benefit for any health plan going forward under the Affordable Health Care Act. So the new healthcare exchanges where individuals can get affordable health care will include mental health and addictions benefits. The expansion of Medicaid in any state will include behavioral health benefits. So for the first time in perhaps our history, new programs are going forward where mental health and addictions conditions are on parity with medical conditions. And that is very promising for people with these disorders. You know, they're brain disorders. They're disorders from the neck up. They shouldn't be treated any differently than disorders from the neck down.
Right. You have a great way of explaining that. Someone with an addiction, really the brain function is different.
The assault of a substance on a susceptible brain changes the physical structure of that brain. An addict is fighting their anatomy for the rest of their life. And they deserve our respect and encouragement because that is not an easy thing to live with. And I admire people in recovery greatly.
And it shows, and I think everyone there, that there is a great respect for people when they come into that the addiction center, that they are treated as humans with dignity, and they're given the tools.
Right.
So that's why the success rate,
and
that's why they
we
stay.
work on building their hope and their courage.
And it does show. Looking at the future, what's ahead on your plate this year? I know I've heard about some things, and you've mentioned some. Some initiatives that are happening here. What's probably one of the top goals that you have overall?
We are working with Lake Erie College of Osteopathic Medicine, their training consortium, to offer psychiatric residency programs if all goes as planned in the year 2014. Many people don't really understand that the difference between a primary care physician and a psychiatrist is 4 more years of medical training. These are highly trained specialists, and the 4 years of training have to happen in a residency program. So Manatee Glens will be accepting 3 physicians a year and training them to be psychiatrists, both their neurology, their inpatient, their outpatient, and in that way we hope to end the shortage for psychiatry in our region. There's a terrible shortage because it's hard to find doctors who are willing to submit themselves to that additional training.
Yes. Well, and certainly Lake Erie is a fantastic school, and they've been a great community member. So we're fortunate to have them here, and great to see their success. One thing that we have had for 10 years, and we'll certainly have the 11th year, will be the Manatee Glens Walk for Life.
Yes.
We in the community enjoy seeing that. It brings people together. We've enjoyed our METV connection there too.
Yes.
As, folks here have been terrific with that. Tell us a little bit about Walk for Life. I know that will continue. What is that, and why is that so important?
We are trying to raise awareness about depression. 1 out of 4 people are going to experience a clinical depression, which Styron, the writer, described as a storm in your brain. And it's so painful that it predisposes people sometimes to suicide. So we're trying to raise awareness about depression and prevent suicide. we lose more people in Manatee County to suicide than to vehicular accidents. So it's a terrible medical concern, and we do it with the Key Clubs in the high schools. So you come to Walk for Life, you're going to see 800 energetic teenagers in yellow t-shirts doing the electric slide to warm up and then walking over the green bridge. So we're raising funds for our crisis services at Manatee Glens.
And I think it's great to see the community get involved that way.
Absolutely, and so many times people come up to me throughout the year and say, I so enjoyed being involved in that event and I learned something.
I think people initially say, oh, it's for depression and suicide. Oh dear, that sounds like a great way to spend a Saturday morning. But in fact, it's very uplifting, it's positive, there's a great sense of hope for the people who are there.
We have a DJ, Palmetto Kiwanis grills hot dogs and hamburgers, and we have a butterfly release. It's a very moving ceremony, and nobody leaves Walk for Life with a frown.
No. Butterflies being the symbol of new life and hope. And
exactly.
It's a moving experience, and it's just, I think, rewarding to see so many people come together, and families. That it's really reaching.
It means a lot to people who've lost loved ones to suicide. They feel a sense of closure and healing and support that they can't find in their normal day-to-day life. And we didn't expect it to draw folks, but it has, and we now have a memory quilt where loved ones can commemorate someone lost to suicide. And it's also an education to the kids. They see it's real.
Yes.
And they'll know what to do if they're faced with somebody who says, you know, I just don't want to live anymore.
Well, it's so important because with bullying and drugs and other things happening in the high schools, we are unfortunately seeing younger and younger.
Right, and we're concerned for these young people. We want them to know who to reach out to and what to do.
The schools have been supportive in bringing this.
Absolutely.
Well,
the schools compete for the trophies. High school, middle school, and elementary school compete for the most kids who walk. And so you have to defend your trophy each year. Braden River High has the high school trophy this year.
Well, and that's certainly a good school. We'll see if they can hold on to it. There was also a run this year on a shoestring. Did they come out and put together a 5K?
On a shoestring was recently recognized as one of the top running shoe stores in the country. Steve Lischauer sponsored the run, and believe me, it is like putting on a military campaign. It's very precise, and there's lots of things involved in it. I had no idea, but the runners really enjoyed it, and it is a sponsored run, so they do get credit.
Excellent. Well, those are very popular these days. So that's September.
Yes.
Hold on to that date in the end of September. Kind of associated with Walk for Life in this last year, there was a veteran who spoke, and I know that there's been more discussion in the community about veterans and their returning and some of the issues that they're dealing with, PTS, depression, the suicide rates are horrific. Manatee Glens, of course, is aware of that. What are some of your plans in the future for veterans?
What we're working on with veterans is trying to offer more services to them and their families. Not everyone feels comfortable going to the VA. It's a very fine service, and we certainly recommend it. It's a benefit that's available to veterans. Sometimes people want to seek services in their own community. Manatee Glens is a trauma-informed treatment facility. That means we take trauma into account in all of our services. If that doesn't happen, sometimes people can be re-traumatized. We also work with families on normalizing their experience for them and supporting them if they do need help with depression. And so we're reaching out not only to veterans with trauma-informed care and their families, but anyone who's been through a trauma, a car accident, a crime, loss of a loved one, a medical crisis. Those are all traumatizing events. And so those clinical approaches help everyone, not just returning veterans.
Well, sexual assault certainly is a trauma, and that's one that Manatee Glens has seen. And you have a Manatee Glens Sexual Assault Center.
Yes.
And that, I think, will be continuing. It's a collaboration with Planned Parenthood. Can you tell us a little bit about that?
Manatee Glens is the specialist for all victims of rape, whether it be children or adults, boys or girls, men or women. And so we have offered that service for about 30 years now. Victims would have to go to the emergency room for their exam. And that is sometimes a re-traumatizing experience. First of all, people in the emergency room are in distress. And there's heart attacks and strokes and, you know, traffic accidents. It's a very stressful place. A rape victim doesn't rate very high in that triage order because they're not going to die from being raped. They're traumatized. The Sexual Assault Nurse Examiner Center allows rape victims to choose an alternative to the emergency room. They can go to the Planned Parenthood clinic in Manatee County, be met by a trained nurse who understands how to collect evidence and how to reassure a victim. Manatee Glens rape crisis advocates are also there for emotional support, and it is a much different experience, much calmer, much more supportive. Law enforcement transports. And so this is one of those things where hospitals, law enforcement, Planned Parenthood and Manatee Glens have all joined together to make this Sexual Assault Nurse Examiner Center, we call it the SANE Center, available to rape victims.
And that will certainly continue. It's unfortunate that that's necessary. I think it's important that people understand that those advocates continue with the victims throughout whatever their needs are and however long it takes. I've heard of a couple of years sometimes.
Yes, because we link people to Victims of Crime Act benefits that they're eligible for. We make sure that they are working through their trauma so that it doesn't become a mental health concern. We support them. We sit in court with them in their depositions if they choose to file charges. You don't have to file charges in order to receive Manatee Glen services. And we've helped kids and adults be able to testify against their perpetrator and feel strong about it and feel safe about it. So we also play a role in law enforcement in convicting the bad guys.
Excellent. Manatee Glens East, that's something that is on the map. Tell us what happens there. We haven't really discussed a lot of that, and what is the future like for that area?
What we've realized is that our community is growing east. Our Manatee Glens West, which is downtown, is our clinic model, and it serves harder to treat disorders for kids and adults for mental health and addictions. We realized that we needed to offer something for folks out east and something that is more like a private practice. Not everyone needs a full-blown, not everyone needs the Mayo Clinic. Right. Not everyone needs the Manatee Glens Clinic. So the East practice is available for kids and adults and mental health and addictions, offering private psychiatric and substance abuse treatment for people who live out east. And we were surprised when we located it there. That practice has over 2,000 patients. So it might be time to think about another location.
Might be time to expand.
Yes.
Just like everything else, we're growing. What about other areas that you see that you might think, well, we need to pay a little more attention, or over the next year we might be emphasizing a little bit more? Have you seen anything that stands out?
We've not won the battle against the prescription pain pill epidemic. We're still losing 7 people a day in Florida to overdose. And the frightening thing is younger people are experimenting with it and dying from it. And so we've got to get education out to our physicians to screen for people who are predisposed to substance abuse risks and to offer alternatives to pain medication. Pain medication is a synthetic heroin, and we need to be much more reticent about making it available, even when there is legitimate pain. It was originally designed for cancer and terminal conditions, and now we're using it when we pull somebody's tooth. It's too prevalent. We've become too comfortable with it, and we don't realize that it's putting a good portion of the population at risk.
And it's not, I mean, it's a widespread area. It's professionals, it's children. Didn't you say something for adults as far as if you have pain pills in your house, what should you do with them?
Lock it up like a loaded gun. because anyone using your bathroom, anyone visiting your home, which could be your kids' friends, can go in your cabinet and look for the medications. If you're not taking those pills, you won't notice they're missing for a long time. Our sheriff has a safe drop. You can go to the sheriff's office on 301 and they will accept your unused pills. And that is the absolute safest thing. Do not keep this stuff in the house once you're done with it.
That's very good advice. I think that you also said that's become a gateway drug for some of these young people.
Yes, it exceeds marijuana now as the first gateway illicit drug for young teenagers.
And so Manatee Glens is right there.
And they're getting it from mom and dad and grandma and grandpa's medicine cabinet. So we've got to get these prescriptions out of harm's way for these kids.
And is that something that Manatee Glens will be working on?
Absolutely. I think that law enforcement and the new prescription pain pill ordinances that have been passed locally are helping us draw people to treatment. And it's going to be another decade before I think we move through this crisis. Sorry to say.
Yes, yes. Well, and you see that in the addiction center? Are you seeing that in the numbers there?
Absolutely. Over the last 3 years, the amount of people in detox have increased by almost 300%. So we're most definitely seeing an increase.
As you look over the next 5 years, we talked about the next year. What about 5 years from now? Where do you see Manatee Glens headed?
We are going to be working with primary care physicians, and we're going to be offering behavioral health services in the pediatric offices, in the primary care offices, so that we truly can integrate with general medicine. And that will, I think, erase the stigma to a great deal. I think it will help primary care physicians get the support they need in treating their patients, and I think it will make treatment available to many more people. So we're moving to healthcare.
It kind of brings us full circle. We started with talking about the stigma of mental health, opening up those discussions, bringing it through that way. 25 years from now, where's Manatee Glens going to be?
Wow, you know, I would love to say that the community no longer needs Manatee Glens, that there is research that offers a cure, and that prevention and early treatment is available to everyone. And so we won't need a specialty facility like Manatee Glens anymore. I think that would be the best outcome in the future.
And certainly working towards that, working your way out of a job almost.
I don't think I'll be working in 25 years. I think you and I are safe.
Now, come on, Mary. You know, you're quite the stalwart. You could be.
I could be starting my second career then.
Yes. Well,
maybe in anthropology, something
something really kind of fun.
Yeah.
How can people help? They're listening to this today and saying, "Wow, Manatee Glens has a lot to offer the community. I want to get involved." What are some of the things?
Oh, we have so many ways to get involved. We love to accept volunteers. Kalena Goodyear is our volunteer coordinator. She'll accept a call at 782-4299. People can also get involved with our events, the Walk for Life and our Champions for Children's Breakfast, April 4th, to help us raise funds. And people certainly, if they're looking at wanting to make a difference in the community with a worthy charity that truly is effective, then they can go on our website and donate to our services and allow us to maintain our services to people who need help.
And there's so many opportunities within that of what they want to, if they want to target for children or for addictions or whatever it might be. That there's
and if anyone listening today is grateful to Manatee Glens for having touched their lives or the lives of their family, that's the best way to thank us, is to donate funds so that we can help the next family that comes through the door.
Exactly, because that's important to keeping the doors open, isn't it?
Absolutely. We've had an increase from 12,000 people served each year to 15,000. And we do not want to turn a family in crisis away who needs help for mental health and addictions.
You don't turn people away, and you don't give up on people.
No, we don't. I tell a story, maybe you're thinking of that story, of a colleague of mine who works in another nonprofit, and one day we were at a meeting, and she said, I want to thank you. And she had a very serious look on her face. And I said, for what? You detoxed me 12 times. She was an alcoholic and a drug addict, And every time she came to us, we didn't give up on her. We offered her hope until finally she was able to stay sober, to stay in recovery. And I would have never known that she had that history if she hadn't told me, because she's a very effective professional.
Isn't that something? And you think how many others there are like that.
Right.
It's all walks of life. And I think
Absolutely.
if there's one message that we can get out is get help.
Yeah.
It's,
and the sooner the better, because we don't have a cure, we can only treat it. And a condition is more easily treated in its early stages.
As with everything.
Yeah.
And with the children, because they are our future. We're seeing some great results with those children's programs. I see the school. Maybe you could, we've got a couple of minutes left.
Well,
Tell about what happens in that one-room schoolhouse.
We have 3 one-room schoolhouses
Yes.
now, because the school system has partnered with us in expanding those services, elementary and middle school. Kids sometimes experience school as a threat and a challenge, and educators are kind of helpless to deal with some of these extreme behaviors. They can refer to our day programs, and we become the puzzle solvers. What's going on with that kid? What's going on at home? Do they have an underlying behavioral health condition that's not been treated? Do they need counseling and behavioral techniques that will help them cope with their frustrations? And with the kids, in 2, sometimes 3 months, they're able to go back to their regular school successful. So that partnership with education and behavioral health is a wonderful way of giving kids the success tools that they need.
I was impressed with the way they work with the entire families. And
Yes, parents get homework
Yes.
in our one-room
Yes.
schoolhouse.
And that they can't get kicked out.
No.
That is.
And I think that is an ethos that Manatee Glens carries throughout all of its services. We are trying to challenge ourselves to meet whatever needs come through our door. We're not looking at, well, we don't do that service and we don't treat that kind of case. We're trying to respond to what our community needs us to be. And I think that's why we enjoy the support of our community. They know that we are striving to meet the needs.
And middle schoolers, which are sometimes a real interesting group of people.
Middle school is a fascinating time of life. I wouldn't repeat it if you paid me.
Never.
The brain is changing more at middle school than at any time in a child's life, except when they're a toddler. And it's a terrifically challenging time, as any middle school teacher will tell you, and any middle school parent will tell you. And I think that's when many times mental health problems come to the fore, many times when alcohol and drug problems start. And so middle schoolers are a special concern of ours, and we want to be able to support them. I think people underestimate what middle schoolers are going through, just as a normal developmental time of life.
Right. But Manatee Glens and the school board have a terrific program that's, I think, very impressive, and it's got to give comfort, as you say, to the families.
Right, and any parent can call us and inquire about it. They don't have to have a referral from the school system. They can come for an assessment just based on their own concerns.
And you know, we're seeing, I think a lot, it's come to the forefront with some of the like ADHD, as well as Asperger's, autism, spectrum disorders.
Right.
Manatee Glens is offering some things along those lines as well.
Yes, you know, we again are partnering with schools that specialize in autism spectrum disorders. What we offer is support. Dr. Bart Hodgins, our child psychologist, offers diagnostic testing so we can really see what's going on with the kid and offer suggestions to parents and teachers. And our child psychiatrists offer medication support because, unfortunately, with autism, depression and anxiety are often co-occurring conditions, and they have to be treated, as well as working with the developmental issues with an autistic child. So we can support through diagnostic and also medication therapy when it's indicated.
Absolutely, and there's a team approach that people might be
Yes.
surprised. It's not just
Yes.
here's your one psychologist or your psychiatrist, but you have
Right.
what's in place there.
Right. Well, for children and teens, we have The CAT team. This is
Love the name.
a hospital without walls that's available for kids with serious problems of all sorts: autism, behavioral, co-occurring alcohol and drug issues. And the team includes the psychiatrist, the nurse, the counselors, the mentors, the respite workers. We all work together to support that family in raising that child to a place where they can succeed in school and with their friends and at home. We also have 2 teams for adults. The intensive outpatient team, we pick people up right from discharge from the hospital and crisis center, and we work on stabilizing them in the community. And the FACT team, the Florida Assertive Community Treatment Team, which is an alternative to the state hospital. So we're very proud of those intensive services. They've been wildly successful for people who have been discharged from the state hospital when it closed in 2002 have not been hospitalized at all in the intervening 10 years. Now that's success.
So they're living at home.
Yes.
And being somewhat productive members of society.
Many of them have their own apartments, they're going to school, they're working part-time, they're volunteering. People don't need to be in a state mental hospital many times if they have the right supports in the community. And I think that's something that is a message for our nation as a whole. Getting back to your earlier topic about violence in communities, if we can support people with serious mental illnesses, they can be contributing members of our community and never a threat.
Yeah, I feel like we're completing that circle here and talking about what really we are doing right now. And the FACT team, as you mentioned, that hospital without walls, that's keeping people engaged, and somebody's watching them, for lack of a better, in that they're constant, making sure they're taking their medication.
The team, you know, the nurse can go home, knock on the door, here are your meds, how are you feeling today? It's a brief intervention in somebody's life, but sometimes that's all it takes to keep people on track. Many of these folks do not have families to support them.
Is that a model that the rest of the country should look at?
It is a model. It is a model.
Come to Manatee Glens and see what they're doing.
We can't take credit for it. It was started in Wisconsin about 30 years ago. Florida adopted it wholeheartedly 10 years ago. There are probably 22 FACT teams throughout Florida, and it's something that Floridians should be very proud of because the state supports it.
Well, it seems to make so much sense.
It does, and I'll tell you why it makes sense to a taxpayer.
Okay.
A year in a state mental hospital, $150,000. A year in the FACT team, $12,500. It's a great deal.
I'm not a great mathematician, but I'll take that deal. And the people, I mean, we always get back to the people. They're happier. I mean, we have some great stories.
Absolutely.
And we've met some of these wonderful.
You know, we also partner with the Village of the Arts. We do an annual art show called Art in Recovery for people in recovery from mental illness and addiction. And several of our FACT team members have won juried art shows for their art. I think it's an expression of how humanity can persevere through so many challenges and how beauty can be created from that experience. And people sometimes need to be reminded of that, because sometimes people have the wrong idea about mentally ill people. They're fearful, and there is no need to be, because in my experience they're compassionate and kind human beings, because once you've been through suffering, you are wanting to seek happiness for other people.
And the beauty of what they do. The art is just incredible.
Yeah.
These folks are
we'll have
talented.
To, next October, everybody has to come to Village of the Arts the first Friday to our opening at Still Life in G Gallery and see the work for themselves.
Yes, and takes the scariness out of anything to do with mental health, and that's part of this discussion that we as a nation need to have.
Right. We've got to erase the stigma if we're really going to prevent the kind of tragedies that happened in Connecticut at Sandy Hook Elementary. And
to see meet some of the people that have been through the FACT team and the programs at Manatee Glens. I'm inspired every time I meet someone.
Yeah.
And I'm sure after 25 years, are you still inspired when you meet them?
Well, and yes, absolutely. I want to tell a story about one of our day treatment program, one-room schoolhouse folks. She was 10. every morning crying, throwing up, scared. You can imagine a busy mom trying to get their kids off to school and dealing with this kind of trauma, and having to lift a 10-year-old into the car and her not wanting to go to her school. And finally came to the day program where this child was diagnosed with generalized anxiety disorder, a medical condition easily treatable with medication. We also taught the little girl to do deep breathing, recognize that it was a condition, that it wasn't her, that she could live with it, that she could handle it. And that young woman addressed our Champions for Children's breakfast attended by 400 people. To go from being afraid to go to school to being able to speak in public, which most adults don't feel comfortable doing,
Yes.
I think is an example of why we're so anxious for people not to delay to get help. Because that child would have ended up in a psychiatric hospital if she hadn't gone to our one-room schoolhouse. Treatment works.
Yeah. What a great message to start the new year. Treatment works. Let's open up the discussion. You're full of hope. If there's one thing I'll say from you, you're inspiring and full of hope.
Well, this work is very inspiring, and I want to make a pitch for people considering going into the field, because it is very fulfilling. I told the boss who hired me 25 years ago that I was only going to be here for 3 years. And obviously, I fell in love with the work and found it very satisfying over an entire career. We do accept interns for bachelor's and master's. We work with the schools. We accept volunteers for people who want to see if this is the field and career for them. And we encourage them to consider it as a field because it's very, very satisfying. It's never boring. No human mind is like another. And so every patient is very stimulating as a professional and a clinician. And you get a personal relationship with your patients in a way that you don't necessarily in other fields. And that is very satisfying. So Manatee Glens is accepting applications right now on our website for professions who want to work with us, nurses, counselors, physicians.
I'm amazed at how many people start in Manatee Glens, maybe as a ward nurse or a clerk kind of position, and stay there and work their way up.
And in fact, I'm one of those people who started as a director and have worked my way up through the ranks. I think that it is surprising to people to hear this, but Manatee Glens is the 15th largest employer in Manatee County. We offer very good benefits, and we are a mentoring organization. If you want to learn your field in mental health and addictions, Manatee Glens is a wonderful place to really see all kinds of clinical presentations and all kinds of cases. So we welcome nurses, clinicians, and physicians to train with us and to apply with us.
That's great. And the future is certainly bright, and there's hope for our community. And that's a great message this time of year, and we do appreciate your time. Mary, thank you so much for spending time with us today. This does wrap up this edition of Manatee Glens Report. Thank you, the audience, for tuning in to the Manatee Glens Report here on METV, where you can learn something new every day. We'll see you next time.